Hello everyone, and welcome to my presentation today where I will give you an update from the WFDB, the World Federation of the Deafblind, and DBI, Deafblind International, on our working group on the global definition of deafblindness. My name is Walter Wittich and I work at the University of Montreal in Montreal, Canada. The DBI and WFDB working group on the definition is a collaborative group that was created in 2023. It consists of myself from Canada, Meredith Prain from Australia, Saskia Damen from the Netherlands, Henriette Hermann-Oelsen from Denmark, Lucia Darino from Spain, Helle Boylen-Selling from Denmark, and Marguerite Thibaudot from the United States. Trying to define deafblind is not a new activity, but it is an important activity that we've been engaging with. In 1995, Lagati started exploring, for example, how we spell and hyphenate deafblindness, and he was the first one to formalize that deafblind should be one term, not a hyphenated term. There have been other explorations of our use of terminology and language, and given that most of the research literature is published in English, this is an issue that touches all of us if we're communicating internationally across different languages. Dual sensory impairment is a term that is more easily understood in the context of working with older adults. It is less threatening to people with acquired vision and hearing impairments, and it is interesting that in Canada, for example, some of the organizations will have their own creative way of how they spell the word deafblind. For example, the Canadian National Institute for the Blind has avoided this topic altogether by simply spelling the entire word in capital letters. So there are different solutions in different places for this problem. We have recently developed a core set for deafblindness using the International Classification of Functioning, Disability and Health, or ICF. For those of you who are not familiar with the ICF, most people understand it as a framework that allows us to view any given health condition, how it interacts with different body structures and their function, how it influences activity and participation, and how these variables are then further influenced through environmental factors. So if we use deafblindness as an example, it does have a code in the International Classification of Diseases, the ICD. This code is for dual sensory impairment, given that it is not the cause of any single disease. And so if we look at something like assistive technology, for example, which is considered under environmental variables, we can see how it would influence communication, which is considered part of participation. And so if you can frame and view more globally any aspect of this biopsychosocial model, it helps us to integrate deafblindness into a perspective of this kind. The ICF core sets were developed specifically with the aim to identify the most important aspects, dimensions, and core domains of deafblindness according to a consensus that we reached with individuals that have lived experience. This included persons with deafblindness as well as their family members. We also consulted with experts in the field of health and social services and support systems and the perspective of researchers as well. Now we can explore if the aspects that are reflected in the global definition are the same aspects that emerge from the ICF model. So why are we looking at a global definition? Many countries do not have a definition of deafblindness, and many existing definitions have a very specific purpose and are then limited in what we can actually do with this definition. And so we're trying to provide a larger perspective on this idea of definition And we're also trying to be as optimistic as possible and create a potential gold standard definition that lets everyone strive to something more idealistic and more optimal. We'll now look at the starting points for this definition. If we look at eligibility criteria for services, this is a traditional medical model approach of how most definitions have worked, and they originate within body structure based on body function. If we look at the functional effects of deafblindness, now we're looking more into the psychosocial model of disability. We're exploring the effect of activity and participation. However, another aspect to point out here is the self-reported and the identity-based approach to defining deafblindness. We are introducing a focus on lived experience, which is really more connected to the personal factors. The Nordic definition of deafblindness is simple and elegant, and it simply states that deafblindness is a distinct disability, and deafblindness is a combined vision and hearing disability. It limits activities of a person and restricts full participation in society to such a degree that society is required to facilitate specific services, environmental alterations, and also technologies. This definition is also endorsed by the WFDB, and it is also in line with what is proposed by Deafblind International. It is a simple and elegant definition. It is a popular definition, and here is a global and common starting point in terms of how a definition could be used and could be useful. I will encourage you to read the Nordic definition again in full, just for your own benefit. However, the members of the World Federation of the Deafblind have said the wording of the Nordic definition is not meaningful across all languages and contexts, so a global definition is still needed. The World Federation of the Deafblind has chosen an approach that is categorical about whether people are hearing, hard of hearing, or deaf, sighted, partially sighted, or blind. And so we fall into several of these areas because sometimes these areas can overlap, and that is where you end up being considered as deafblind. The World Federation has also tried other ways of visualizing these definitions and these categories, but then we're still in the world of categories, and that means some people are in, some people are out, and I think that part of our efforts right now are to find ways of working around categories or to smoothen the edges, if you want, as part of this exercise. Of course, context also matters. Here is an example from our friends in the United States where we're looking at definitions that are used in the context of education. So we're looking at children with deafblindness, whereby the definition here tells us there are severe communication and other developmental and educational needs. And of course, that is relevant in the context of education for parents, but also this context changes when you look at older adults. Here is an attempt by the WFDB to give us an overview of the different possibilities, whether you are born without any sensory function and you live into old age as a deafblind person, whether you're born with one loss but then you develop the other, and this could be hearing or vision, or whether you are born sighted and hearing and you develop deafblindness over time. Here, time of the onset is flexible. There should be a bit more flexibility respected in the severity of things, but there's only so much we can do with one figure. But it helps you to show the complexity and the heterogeneity in the population, and that explains why this is so complicated. So we have been exploring the dimensions of deafblindness in the medical model. In the medical model dimension, we're focusing on eligibility criteria, things like visual acuity, visual field diameter, pure tone, audiometry averages. There are other more subtle measures like contrast sensitivity or speech in noise comprehension that may functionally actually be more important or more devastating if they are impaired, simply for things like comprehension of speech or recognition of faces. But they can be expressed in a numerical model in a quantitative way so that they don't necessarily have to be a qualitative dimension. If we move further over into the psychosocial model, we're now looking at function and functional difficulties that can either be self-reported, but they can also be observable. But it's not necessarily on a scale from 1 to 10. Finally, let's return to the idea of self-report and the personal dimension. This links us to the fact that we need to consider the identity of the individual and their lived experience as a person that is living with combined vision and hearing impairment. So where are they themselves on their own definition, and who are they and what are they? A statement made by a person with deafblindness in the work of Alana Roy during her PhD in Australia was, being deafblind, it's who we are, not what we are. And so this idea of identity is not necessarily reflected in any of the measurements that we've been exploring up until now. So what the Global Definition Working Group is currently working on is to work towards a global consultation on this topic. We're considering what we could look at in terms of a triangular model that would consider the medical, the functional, and the personal dimension. So let's say we have a person who has no light perception, whose pure tone average is about 60 decibels hearing level across 4 frequency. Here's a definition of the medical placement within the model. It could very well be that this person is a proficient Braille reader, is well adapted to home and work environment, and is also proficient as a speech reader and manages well with 2 hearing aids. So now the functional impairment may actually not be as severe as what is expressed within a medical model. However, then when you speak to this person, they consider themselves blind with a hearing impairment and not deafblind. How we now express and visualize this, that is where we have some creative ideas on how we might be able to create a 3-dimensional version of a definition. But this is still under development. Our current steps are that we've been conducting a literature review under the leadership of Saskia Damen at the University of Groningen in the Netherlands. And we're also conducting a global consultation with deafblind people across the planet that is currently conducted by my team here in Montreal. So we will keep you updated on our progress. We encourage you to become members of Deafblind International. Individual membership is free, and all you have to do is go to the website of Deafblind International. I want to thank you for your attention, but I also specifically want to thank the organizations that have supported us with funding to do this work. And I encourage all of you to find out about our project on the ICF Corset and our collaboration at whoisdeafblind.org. Thank you.